Welcome to the third episode of our podcast.
Couple of lawyers, arguments and thought.
We are your hosts from Sansa Legal, and today we wanted to talk about, a subject that's close to our hearts, an industry that is rapidly transforming healthcare access across the country, e-pharmacies.
Let's jump into it.
So it's a bit like stepping onto a crime scene.
Yeah.
You've got this booming industry delivering medicine right to people's doorsteps, but it's all happening under the shadow of laws that are seriously outdated. We're talking rules from 1945 trying to keep up with the internet age.
It's a classic case of technology sprinting ahead while legislation tries to catch up, and as you can imagine, that creates a real tension between fostering innovation and ensuring public safety.
Exactly. So to crack this case, we need to start with the evidence.
Okay.
Exhibit A, the e-pharmacy bill of 2018.
Okay.
Now, this bill is still in draft form, but it aimed to bring some much-needed order to healthcare.
One of the key provisions of the bill was the idea of creating a digital trail for every medication sold online. Imagine a system where each pill can be traced from the factory floor all the way to the patient's doorstep. And the bill also pushed for stricter data privacy rules.
Right.
You're sharing a lot of sensitive information when you order medication online, so protecting that data is paramount.
Absolutely. It's like the Hippocratic Oath for the digital age. First, do no harm applies to your data as much as your physical well-being. But here's where things get even more interesting.
Right.
We've got this push for regulation.
Right.
But then we have telemedicine bursting onto the scene in 2020 and actually giving e-pharmacies a major boost.
It's true. The 2020 Telemedicine Practice Guidelines essentially gave e-pharmacies a turbocharged engine. Suddenly, doctors could consult with patients and issue prescriptions online, creating this seamless pipeline from diagnosis to medication delivery.
Think about it. You could literally be in your pajamas, feeling under the weather, and have a doctor's appointment, and your meds sorted all without leaving your couch. Talk about convenience.
And that convenience became even more crucial during the COVID-19 pandemic.
Right.
It was a tragic situation, no doubt, but it also highlighted the vital role e-pharmacies could play in a crisis.
It's almost like the pandemic forced everyone to acknowledge that the future of healthcare was already knocking at the door. Suddenly, doorstep delivery of medication wasn't just a luxury.
Right.
It was a necessity.
Right. The government even stepped in to facilitate this, recognizing that e-pharmacies were helping to bridge a critical gap in access to healthcare.
It's amazing how a crisis can accelerate change, isn't it?
It is.
But as with any rapid evolution, there are bound to be some growing pains. And that brings us to the other side of our investigation, the challenges and concerns surrounding e-pharmacies.
One of the biggest concerns, as we've touched upon, is drug quality.
Right.
Without a robust system of checks and balances, there's a real risk of substandard or counterfeit drugs slipping through the cracks.
You simply don't know what you're getting sometimes.
Yeah.
And it's not just about the quality of the drugs themselves. It's also about the potential for misuse and self-medication.
Exactly.
Yeah.
When you remove the face-to-face interaction with a pharmacist, there's a greater risk of people making uninformed decisions about their medication. And it gets even more complicated when you consider the different categories of drugs and their respective restrictions.
It's the difference between picking up a pack of cough drops at the grocery store and getting a prescription filled for antibiotics.
Yeah.
E-pharmacies need to be able to navigate these complexities in a way that ensures both accessibility and safety.
And speaking of safety, there's another layer of complexity when it comes to licensing. The rules are murky when it comes to delivery agents and distribution hubs.
It makes you wonder if something goes wrong with the delivery, who's actually accountable.
Yeah.
It's a bit like ordering food online. If your order is wrong or arrives late, who to contact. But with medication, the stakes are so much higher.
That lack of clarity is a real concern. It's like a missing piece of the puzzle in this whole e-pharmacy ecosystem.
It seems clear that India's existing laws, like the Drugs and Cosmetics Act of 1940 and its rules from 1945, are struggling to keep up with the realities of 21st century healthcare.
And it's not a problem unique to India. Many countries around the world are wrestling with the same question. How do you regulate this new frontier of healthcare without stifling innovation?
Right.
It's a tightrope walk, to be sure. It requires a delicate balance, but what's clear is that reform is needed, and that reform needs to be multifaceted.
Okay.
It's not just about slapping a new coat of paint on those old laws. It's about building a whole new framework.
Okay, so let's talk blueprints. What would that new framework look like? What are the key pillars that need to be addressed?
First and foremost, we need to establish crystal clear quality control standards that are specifically designed for e-pharmacies.
Okay.
We can't just assume that the same rules that apply to brick and mortar pharmacies will automatically translate to the online world.
So we're talking about things like independent lab testing to verify the authenticity and efficacy of medications sold online, right?
Exactly.
And ensuring secure supply chains so that there are no weak links where counterfeit drugs could sneak in.
Exactly. We need to create a system where consumers can be as confident in the quality of medications they buy online as they are in those they buy from their local pharmacy.
And of course, we need to close those licensing loopholes we talked about earlier. The lines of accountability need to be clearly drawn so that everyone involved in the e-pharmacy ecosystem, from the platforms themselves to the delivery agents, understands their responsibilities.
Absolutely. But we can't have a situation where it's unclear who's ultimately responsible if something goes wrong. That erodes trust and puts patients at risk.
And then there's the elephant in the room,
Uh-huh.
the types of drugs that are available online. We need to have a serious conversation about which medications should be accessible through e-pharmacies and what safeguards need to be in place to prevent misuse and self-medication.
That's a crucial point. It's not about banning all prescription drugs from being sold online. It's about creating a system that balances access with responsibility.
Right.
For example, certain medications, like those with a high potential for abuse, might require a mandatory online consultation with a qualified doctor before they can be dispensed.
That makes a lot of sense. It adds an extra layer of protection for the patient and helps to mitigate the risks associated with self-medication. But creating these new rules is only half the battle. There's also the challenge of enforcement, right?
Absolutely. You can have the best laws in the world, but they're only as good as their enforcement. And in a country as vast and diverse as India, with its varying levels of technological infrastructure and digital literacy, that's no easy task.
It sounds like it's going to require a collaborative effort between the government, the healthcare industry, and technology companies to create a system that's both effective and sustainable. But let's shift gears for a moment and talk about the other players in this game. What about the traditional brick-and-mortar pharmacies? How are they reacting to this whole e-pharmacy phenomenon?
Understandably, there's a mix of apprehension and adaptation. Some traditional pharmacies are understandably concerned about the rise of e-pharmacies.
Right?
They see it as a threat to their livelihoods and worry about being left behind in this rapidly evolving digital landscape.
But I imagine there's also a sense of opportunity here. After all, e-pharmacies aren't going anywhere. In fact, they're only going to become more prevalent.
Precisely, and that's why many forward-thinking brick-and-mortar pharmacies are exploring ways to adapt and integrate e-pharmacy elements into their own businesses. They're realizing that they need to embrace technology if they want to remain competitive.
So it's not necessarily a zero-sum game. There's room for both models to coexist and even complement each other. But that brings up an interesting question about fair competition. Should e-pharmacies be subject to the same regulations and licensing requirements as traditional pharmacies? Or should they be given more leeway, considering they're operating in a different environment?
That's a complex issue with no easy answers. On the one hand, you don't want to stifle innovation by burdening e-pharmacies with unnecessary regulations, but on the other hand, you need to ensure a level playing field so that all players are operating under the same set of rules and held to the same standards.
It's a delicate balancing act, and it's one that policymakers are going to have to grapple with as e-pharmacies continue to grow in popularity. But beyond the economic considerations, there are also ethical ones to consider.
Absolutely. For example, we need to ensure that the convenience offered by e-pharmacies doesn't come at the expense of patient privacy and data security. We need to establish robust safeguards to protect sensitive medical information and prevent data breaches.
Right, we've already seen how data breaches can have devastating consequences for individuals and organizations. We can't allow those same vulnerabilities to creep into the healthcare sector.
And there's also the question of access and equity. We need to make sure that e-pharmacies don't inadvertently create a digital divide where those without access to technology or reliable internet connectivity are left behind.
That's a crucial point. The goal of e-pharmacy should be to expand access to healthcare, not to create new barriers. We need to ensure that the benefits of this technology are available to everyone regardless of their location, socioeconomic status, or technological savvy.
And that means thinking creatively about solutions. Perhaps it involves partnerships with community organizations or mobile health clinics to reach those in underserved areas. Or maybe it involves developing user-friendly platforms that are accessible even on low bandwidth connections.
It's going to require a multi-pronged approach, that's for sure. But it's clear that the potential benefits of e-pharmacies are enormous. They have the power to revolutionize healthcare access, particularly in a country as vast and diverse as India.
Absolutely. But to harness that potential, we need to proceed thoughtfully and carefully, addressing the challenges and concerns head on while fostering an environment of innovation and collaboration. It's a complex equation, but one that's worth solving.
So let's zoom out a bit and look at the bigger picture. We've been focusing primarily on India, but this is clearly a global phenomenon. Are other countries facing similar challenges with e-pharmacies?
Absolutely. This isn't an isolated issue. Countries around the world are grappling with the same questions. How do we balance innovation with regulation? How do we ensure patient safety in the online world? How do we create a level playing field for all stakeholders?
It seems like there's a real opportunity for countries to learn from each other's experiences and best practices. Perhaps there's even potential for some kind of global regulatory framework for e-pharmacies. But before we get too carried away with visions of the future, let's bring it back to the present. Okay. We've talked about the need for a robust legal framework for e-pharmacies, but we haven't really dug into the specifics.
Yeah.
What would that look like in practice?
The Drugs and Cosmetics Act and its rules, they were written for a world where the internet was pure science fiction. They simply can't adequately address the unique challenges posed by online pharmacies. So a modern legal framework for e-pharmacies in India would need to hit several key points.
Right.
We need clear quality control standards that go beyond those for brick-and-mortar pharmacies, recognizing the specific risks of online distribution.
Mm-hmm.
Licensing has to be crystal clear, encompassing everyone in the chain, from the e-pharmacy platform itself to the delivery driver dropping off your meds.
And we can't forget about data privacy. People are sharing highly sensitive information when they order medication online, so protecting that data is paramount.
Absolutely. A strong data protection law is essential. We need to make sure that e-pharmacies are handling personal health information responsibly and transparently.
And of course, we need to tackle the issue of which medications should be available online. Striking that balance between accessibility and preventing misuse is going to be a key challenge.
It is. It's not about being overly restrictive, but about putting in place sensible safeguards.
Right.
For example, perhaps certain medications could only be dispensed after an online consultation with a qualified healthcare professional.
Right. It's about finding that sweet spot between convenience and safety. But even with all these pieces in place, the success of any legal framework hinges on enforcement.
Absolutely. You can have the best laws on paper, but if they're not enforced effectively, they're meaningless.
So it sounds like there's a lot of work to be done.
Mm-hmm.
But it's encouraging to know that these conversations are happening and that people are actively working to shape a future where e-pharmacies can reach their full potential.
It is, and it's not just a task for policymakers and regulators. Consumers have a role to play too. It starts with being informed and engaged. Do your research before choosing an e-pharmacy.
Right.
Make sure they're licensed and reputable. Look for signs of strong security measures to protect your data.
So it's like being a savvy online shopper, but with even higher stakes because it's your health on the line.
Exactly. And don't be afraid to ask questions if something seems unclear or too good to be true. It probably is.
Right.
A legitimate e-pharmacy will be transparent and willing to address your concerns.
Great advice. So as we wrap up this deep dive into the world of e-pharmacies in India, what's the one key takeaway you'd like our listener to remember?
I think the main takeaway is this. E-pharmacies have the potential to be a powerful force for good in healthcare, especially in a country like India.
Okay.
But we need to be thoughtful and deliberate about how we integrate them into the existing healthcare ecosystem.
It's about finding that balance between embracing innovation and ensuring patient safety.
Precisely. And that's a conversation that needs to involve everyone: policymakers, healthcare professionals, technology experts, and most importantly, the consumers themselves.
So to our listener, we say, stay informed, stay curious, and be a part of shaping the future of healthcare. And that concludes our deep dive into the fascinating world of e-pharmacies in India. We hope you found it informative and insightful. Until next time, stay curious.